Hello everyone, welcome to my YouTube channel SD Nursing Classes and Exam Preparations. Today our topic is barriers of therapeutic communications. So before that we have already studied about the therapeutic communications, the phases of therapeutic communications, types and the goals and characteristics and the techniques of therapeutic communications. So today we will discuss about the barriers of communications. So let's start the topic. So barriers of therapeutic communications. What you mean by barrier? Barrier means there are so many words which related to barrier. Obstacle, block, then hurdles, chain. So these all are words which related to barriers, means obstacle, block, hurdles and chain. So here our topic is barriers of therapeutic communications. Means when we are communicating with our client, with our patient, what all barriers may occur or occurring. So every time when we are communicating with our patient, that time so many barriers may occur. So how to overcome from that barrier, today we will study what all barriers and how we will overcome from the barriers, that our communication should be very effective. So one by one we will read about this barriers. So first one is language and semantic barrier. Language is most important to communicate with anybody. If the language, both the sender and the messenger, sender and the receiver are not understanding each other, so because of language, so it may create a barrier which will be affect to your communications. So in language and semantic barrier, what all things come? Jargon, language differences, poor listening skills. So this is three types. One is jargon, language differences and poor listening skill. So what you mean by these all? First we will see jargon. Jargon means what? This is a words which we use for our profession. Like in medical terms, we use OD, BD for medications. So this is a jargon. And even though other people like IT sector, engineers, they have their own terms of their technical terms they use. So this is what's jargon. We should not use this type of things for the patient, client. Means if you say to the patient, example, if you say to the patient that this medicine you have to take in OD and this is for BD. So is the patient can understand this language? No. So what normally we are using this once a day, twice a day. So like that we have to communicate with the patient. So this is what jargon. We should not use our own professional terms for patient. So this may create a barrier. How we have to overcome from that barrier? That we have to use the word patient can understand and which language, which way patient can understand, and what is common. Means if we'll say like that this medicine is once you have to take and this is twice, so patient can easily understand. This is the overcome from the barrier. This is jargon with anybody, that is because of we are studying in mental health nursing and this is barrier. So I am taking patient example, client's example, whomever we talk, if our language which you are using. If I am talking to some IT sector, yeah, like whoever it may be, what is sector it may be, in which profession it may be, but if I am talking to him about my profession, I am using my medical terms and languages, so that person can't understand this type of terms, so that the communications will be more poor and it won't be effective. So for the effective communication, to get best feedback, we have to be use the terms, language which both can, the sender and the receiver can understand. So that is what jargon. Next is language differences. Yes, just now I told that language, yes, language means what, that we have to be communicate with the patient in that language that which patient can understand, otherwise it is a barrier for the patient as well as for the nurse. Which language we are speaking, we are saying, if you are saying in English and patient can understand that language, so patient can understand Hindi or other language, so we have to what communication we are doing with the patient, we should do according to the patient. That is the overcome. Overcome means how you will make the communication effective. That is, you have to be, how to avoid language barrier, to communicate with the patient in that language which patient can understand, which patient can understand. So this language if will be used for the patient, that patient which is easier for the patient, so the communication will be effective and the barrier will be not there. Poor listening skill is, yes, if we ask so many questions to the patient, means again and again we are asking many questions to the patient and we are trying to like probing or interrogating his life by asking many questions and making irritation to the patient. So this will be a poor listening skill, it may occur, because patient will be confused and he may irritated, yeah, confusion may occur. So the communication will be not effective, that will be a barrier, poor listening skill. So that's why we should not behave that type of behavior to the patient, that again and again we should not ask question and make him irritated. So this is what poor listening skill. This is first barrier, language and semantic, that is 3 types: jargon, language differences and poor listening skill. And second is what? Cultural and social barriers. So cultural and social barriers means what? In India itself there are so many, that is 3 types. In India itself there are so many types of culture. According culture, state wise it may differ. So when the patient is there in each area, you are there, and patient, your culture and the patient culture is different. So in this time what happen, you have to understand patient's culture, his belief and his understanding, so his value. So you have to understand that how to overcome from this type of issues, means we have to first understand the patient, understand the patient. Second is what? We have to understand his culture, belief and values. So by understanding all that about the patient, then when we communicate with the patient, that communication will be effective. You can overcome from the cultural and the social barrier. Cultural difference means your culture is different and patient's culture is different. If you have posted on that area that is known to, that is totally different from your culture, and you have to be adapt that culture and behave accordingly to the area or the patient or the client. So then only the barriers will be overcome. That is cultural differences. Then second is what? Social characteristic. Yes, social characteristic means factor like age and religious belief can create communication challenge. Yes, it is. Many times we face in hospital, like if aged patients are coming, if aging, if aging patients are coming, so they have something like that mood swing problem arise, and I have seen that the patient may different, they may show different type of personality also. So sometimes mood swing problem probably happen. So this type of patient if there, then how you will communicate with them? That will be a social barrier. Social characteristics means that patient if he is aged and he is believing something that today is a Friday, I will not take anything, I will not eat anything. So if he will not eat anything, then how he will take medication, how will take medicine? So for that you have to mingle with the patient and make him to understand about all that no, this is for your beneficial and you have to take the medicine, that's why you have to eat. Otherwise after discharging from hospital, you will go to your home and just continue your religious work. But here you have to, in hospital you have to take all this, you have to cooperate with us. So this is what social characteristic and how you overcome from that social issues, social barrier. Then gender is gender. Sometimes what happen, that is difficult for the health worker, like a nurse to come to manage with opposite gender. Like if the nurse nature is something different, if she is being shy nature or extra introvert personality, so this type of they can't manage the people like male person, yeah something like different person. So in this case what happens, gender also a biggest barrier. So what is the overcome from that? How you overcome from this gender barrier means, this we have to keep in mind that we are nurse, we have to give care to the patient, give care to the patient. All are same for us, we never forget that. So this is the overcome, means how we have to keep in mind that as a nurse, if you have studied about nursing field, you choose nursing field, then that should be keep in your mind that all the patient is same for you. So everybody you have to give same treatment and same behavior. There should not be any gender, any type of things, whatever his profession, anything that should not be affect to you. So this is the overcome from the gender issue. So this is what cultural and social barriers, cultural differences, social characteristics and gender. And third is psychological and emotional barriers. Psychological means what? Anxiety and stress, fear, emotional, and providers emotional state. This is very very important, because the whole nursing means especially psychiatric nursing is based upon the psychological and emotional procedure. Means this is a procedure for us only, means we have to always observe patients psychological emotional level, and how, what is the patient's condition, he is panic or he is like in very low phase. So all these things we have to observe in psychiatric nursing. So psychological emotion, this is the barrier. So when this is anxiety and stress, this is 4 types: anxiety and distress, fear, emotional state, and providers emotional state. So anxiety and fears means what? If patient is in very tense, yeah, he is very anxiety moment, he is having stress or anxiety, so how you manage with the patient, how you communicate with the patient, that is up to the nurse. How you manage the patient, that is up to the nurse, that how by seeing patient's anxiety level, stress, either he is a depressed patient. So all these things you have to for overcome. How you overcome from this anxiety and stress issues, stress barrier means you have to always always observe that patient's condition. He is an anxiety person or he is being stressed or depressed, so that time I should not talk to the patient, I should not communicate with the patient, so the communications will be not effective, that will be not work, so it may be a barrier. So that's why what, by seeing the condition of the patient, by seeing his environment, his mind, you communicate with the patient, so then the anxiety and stress barrier will be relief, that we can overcome from that. Fear also like that. If client is not talking properly, if client is not talking properly, fear barrier, fear. So this is a barrier, how to overcome. If the client is not talking properly, and the nurse should understand that, the nurse should observe and notice the what happening to the patient. If the patient is being hesitating or having dread and fear to ask the nurse, and the nurse is coming in front of him only, but he is not asking anything, he is being agitation, he is being confusion, that things nurse should observe from the patient. Then she only make the patient comfortable and speak to her, then the patient will be comfortable and speak all his queries, all his doubt, ask to the patient, nurse. So this is what you can overcome from the fear. Means by fear, see, maybe the patient may be judgmenting that if I ask him something, the nurse may anger, yeah, she may like she may not answer me, so like that type of question may inside the patient mind. So how we will make patient comfortable and talk to us, that is up to the nurse. And emotional state, yes. So emotional state means what? Emotion, that may be anger or depression, so if the patient is in anger or high emotional state, means we can't talk to the patient in that time. This is also a mind of nurse, the how to overcome from this type of barriers, emotional barrier. So in that case, what happened, that is the up to nurse, that how she will provide, how she can understand patient's condition. If the patient is not feeling good, if he is in deep anger or deep depression, so we should be calm, we should pause ourselves that no, we should not talk to the patient. When you first time went and trying to talk with the patient gave very irrelevant behavior, so that time itself you have to stop everything there. And after some times, when after observing him, that how his condition, how his posture and gesture, then if he is normal, then only you should go and talk to the patient. This is what emotional state. So that is the overcome, how you overcome from this emotional barrier, emotional state. Provider's emotional state. Next is provider's emotional state. Yes, sometimes providers means we, the nurse. What is our emotional state? If something happened to our in our home, and that things has been in our mind, and we went to hospital, and that type of anger, yeah, sadness we are showing in front of the patient. So this is what, this is a self, we should, that is the lack of self awareness, that can be a barrier for your effective communications. So that the providers means the health providers feelings, biases, that should not be there. So if she doesn't like the patient, so then also she should not show that I don't like you. She should not show that that patient is not good to me, she is not from my religion, like that. So these all things you should not differ. This is what, when you do like that, means there should not be any barrier. If you will control your emotional level, so there should not be any barrier, you can overcome from the barrier. So this is the provider's emotional state, lack of awareness. We should be always aware about ourselves, that whom we are talking and whom we are, where we are not in our home, we are in hospital, we are not in home. So these things always we should have to keep in mind. This is what about psychological and emotional barrier, that is anxiety and stress, fear, emotional state, and provider's emotional state. And fourth is physical barrier. Physically, this is like noise, accessibility, sensory overload. Means what? Physically, if there is loud noise can be a barrier for the effective communications. If we are talking to the patient for any important things, and suddenly some noise came, very loud noise came, so your communications will be not in progress, that will be not effective. What you are saying patient can understand, what patient is saying you can't understand. So in this time what happened, the noise is a biggest barrier. So for that, to overcome from this noise, what to do? You have to stop there itself, should not talk to the patient. Then you can speak, you can say to the patient that yes, after some times we will talk, just wait for some time until the sound stop. So this is what noise. So noise, because of noise we can't communicate with the patient, with anybody here. Again and again I'm using patient because we are studying in mental health nursing, and about the barriers means we obviously I will say about the patient only, the client only. So this is the noise. Then second is accessibility. This is what any type of technical issue, if anybody remote or communications means technological location or any type of like participations. So this is the accessibility. So what happened here? This is the barrier. How to overcome from this? Like if I want to meet meet somebody, I said him that you just come to the place, some particular place that we will meet there. So the person whom you want to meet, he doesn't know about the place. He was just searching and searching, but at the end also he didn't get that. So in that case, what is the barrier? The location is the barrier. So whenever we are communicating with him, we should choose a correct location which will be easier for the messenger, the receiver, and for the sender. So this will be overcome from the location barrier. And next is technology. Yes, technology means what? If in a place, in a crowd place, if someone is there, if any guest is there though, so people are waiting for him to listen him. So that time the guest, what he is saying, people can't able to hear. So what happened in that time? Where is the defect? That is the defect of the technology, means the mic. So first, what is the overcome? Technology. Defect is mic. What is the overcome? First we have to check that. So before saying anything, something like that, we always shake the mic. That before saying something, we used to say hello, my voice is audible. So like that. So this is what? This is the overcome from the technological barrier. So this is technological barrier. And yes, this is about accessibilities. And third is sensory overload. Sensory overload means what? Means if you want to communicate with the patient is already over emotion. Means if few days before the wife lost her husband, and she was being totally emotional stage, over emotional stage, and that time you are going and you are asking to her, that patient's husband also died. So this type of communicate if you will do with the patient, what will the patient condition? She will be more distress and overwhelmed. So this condition will arise. So for that, you should not speak to her like that if she is already in distress, in deep depression, in deep sorrow. So any encouraging word you can speak to the patient. That is the overcome from sensory overload. From this type of barriers, we have to talk to the patient, which can create positive effect as well as courage and decrease her emotional level. Decrease emotional level. So this is what? This is the overcome from this sensory overload. So this was the physical barriers: noise, accessibility, sensory overload. Then we will see fifth one. Healthcare. Fifth, healthcare provider barriers. Means what? Sometimes we, the who providing healthcare to the patient. So what all negative sense, means negative things may occur from the health worker side that may create the barrier for the effective communications. Like first one is communication style. Next is attitude, knowledge gaps, and boundary issue. So these all things. So communication style means how we are talking to the patient. If your communication style is not effective, means if you are thinking that if the patient is illiterate, yeah, he is like deaf and dumb, so that type of patient you are showing your attitude, means you are showing that you are not caring to them, you are just showing that they are nothing for you. So this type of things should not be there, that you are very like condescending or being not actively listening. Condescending means what? Feeling very like proudy or like arrogant behavior. So this is what condescending means. You are just arrogantly behaving with the patient because they are nothing, they are illiterate, they have no knowledge. So this type of behavior if you are showing to the patient, so your communications will be never effective, because the patient can't understand. You are not talking to the patient, then how patient can understand your words? So this type of things will be what very effective to your communications. Your communications with your patient will be not effective. This is the barrier for the communications. So what you have to do, you and you are asking many questions to the patient again and again, you are just making him irritated. So this will be what? This is the barrier. So how you overcome from this barrier? We should not behave like that. As a nurse, all are same for us. We have to give respect, care, and good posture to everyone. There is their personal life, their professional life is not in our business. We should not go deep of their personal life. Our work is that why patient came to us, we have to give best care to the patient and shows empathy, good behavior, and all the positiveness that patient can get recovery soon and go to home. So this is the overcome from this communications style. Then what? Then attitude. Attitude means you are just knowing that you are biases. If the patient is not from your religion, yeah, in your what you believe, the patient not believe that. So in this case what happen, if you compare the patient with your level, what you believe the patient is not believing, if he is a different religion, which religion really you don't like, so that type of things what happen, so the communications will be not effective because of your behavior. And next is prejudices, means unnecessarily, without any reason, without any reason. You are just disliking the patient, dislike. So these things, without any reason, you are just showing very bad behavior to the patient and just arrogantly you are talking to the patient, then how your communication will be effective? So all these things, lack of self awareness, you should know, you don't have the self awareness that which type of behavior I have to show to the patient, yeah, in which way my gesture and posture, which way I should be behave, and which way I have to talk to the patient. These all things is non aware to you, means how your communication will be effective. So for overcoming, what to do? You should not be biased, you should not be prejudiced, and you should be always self awareness. You should know that you are a nurse and how you have to behave with the patient, and your work is that your profession is that you have to give care to the patient, and there you should not be differentiate the patient by the bias, yeah, anything, any religion, anything that should not be affect to you. So then only the communication will be effective. So this may be a barrier. And third is knowledge gap. If you don't have knowledge regarding the patient, or to understand patient's ability, his condition, then how you communicate with the patient? So knowledge gap, you should be, before meeting the patient, you should know about the patient, everything that has been in the phases of communications. There are 4 phases. Later on we will discuss about that. So before meeting to the patient, you should know about the patient. If the patient is new, for that you can ask the prior knowledge. You should take prior knowledge regarding the patient and go to the patient, that how she is or he is, what is her disease, and which type of patient she is. Like she is depressive, yeah, panic, yeah, which type of patient she is. Everything you have to know before itself, while before meeting to the patient. So then only there should not be any barrier occur. So this is what knowledge gap. If you don't have skill to understand patient's condition, then how we will talk to the patient? So firstly we have to make clear everything. We have to understand the patient, then only we should communicate with the patient. There is the boundary issues. Yes, boundary issues means what? This is a professional relationship, professional client line, means like this is a therapeutic relationship between the nurse and the client. We should not cross the borderline means we should not mingle with the patient personally yeah, deeply. We should not mingle with the patient that much deeply that we are just crossing our borderline. No, this will make issue for our life as well as patient life. So this is what we never do like that. Then only the barrier, this may cause barrier. So because if you mingle too much with the patient, so sometimes what happens, the other people complain to your senior, yeah, any director like that, so that you may dismiss from hospital. So that's why should not be boundary issue, should not be go deep with the patient's life. So that may create a boundary issue. How you can overcome? You should not go to that much deep with patient life. You have to manage the nurse patient relationship, that is therapeutic relationship. This is the 5th one. And 6th is what? This is 6th is patient related barrier. Patient related barrier means just now we studied about healthcare provider related barrier, what barriers may occur from the healthcare provider, and now from healthcare provider side. And now we will study about patient related barrier, means patient, from patient side which all barrier may come. So that which can affect to the communications. First one is the emotional and physical, cognitive, physical, cultural. So emotional, physical already we studied in first psychological barrier, psychological and social. Yes, fear, same, depression, grief or lack of trust. Because of fear and anxiety and shame, the patient can't able to talk with the professionals. And if he is a depression patient, or if he is in sad, or any trust issues is there, so that also problem for the that may create problem for the patient to deal with the nurse. So this is what emotional and psychological already we studied there, fear, anxiety. So for that, what is the overcome? What is the overcome? Overcome is that yes, by understanding patient's activities, conditions, we have to talk to the patient. Talk to the patient. If you are knowing that patient is being very sensitive, and he is not being in the stage that he can talk to us, because he is being too fear and something feeling ashamed to talk. Yeah, maybe she is in deep grief, or she is not trusting the nurse. So these may things occur. So that's why what this is all about, all the responsibilities to all the responsibility of the nurse, that she can manage everything, that there should not be any barrier occur. The emotional barrier is the big barrier, emotional and psychological barrier. So this is all about the feelings. So this is all about what? The feelings of the patient that the nurse can understand. So then the overcome is that feelings, according to feel them and understand their emotion, their mental level, and then make them free, make them comfortable to talk with the nurse. And next is what? Cognitive. Cognitive means what? Low literacy, pain, distraction or inability to focus. Sometimes the patient can't focus anything what you are saying. So if you are saying something, the patient may see here, there, no eye contact. He doesn't want to do any eye contact to you. Again you are saying to the patient, please look at me, I am saying, I'm discussing about this matter, yeah, about your beneficial only. Then also the patient should not, then also he hasn't reacting to your words. So in this case what happened, that is the cognitive pressure, something like that. If she may affecting by pain, or because of low literacy and focus quality is not there, so this may be a barrier for communication. So what you have to do for that? You have to again make him to understand by his level of understanding. Make patient to understand by the level of understanding. How patient can understand? You have to make him understand by his level of understanding. So this is what? This is cognitive barriers. Next is physical. Yes, already we studied in physical barriers. So hearing, speech difficulty and medication side. Sometimes the patient may having speech and hearing difficulties, or sometimes they may affect with medical side effect, medicine side effect. So in this case what happen, if you want to communicate with the patient will be the patient may not communicate with you because of all these things, because of maybe he is deaf and dumb, maybe he is having any pain or any type of medical issues will be there, so that's why he doesn't want to talk to you. So this may be a barrier. So that is up to the nurse that how she can manage and overcome from physical barrier. So this is what physical barrier means. If the patient can't able to hear or speech difficulties is there, the nurse can able to make him hear or go near to the patient and talk to the patient. And if there is any medicational side effect is there, then also patient being not reacting to anything, so you have to first solve the problem, medical side effect, then the barrier will be overcome. This is the physical barrier. And cultural, yes, before itself I told you about the cultural belief about in physical in psychosocial barrier. So cultural means what is the patient's belief, and accordingly we have to give care to the patient. How we overcome from this type of barrier. So first is what we have to make him understand that, see, whatever you are believing, now you are a patient, you have to take medications properly, then only you will be cured and go to your home. So you should not do like this. You should not obey, means you should not obey means that will be harmful for you. So like whatever his belief will be there, if the patient is saying no, today is Friday or Saturday, I should not take anything, I should not eat anything, so then how you will eat medicine? Medicine have so many if medicines are having so many type of reactions, side effects, so for that you have to eat and take medicine. After curing, you'll go to home and start your religious work there, continue their religious work, but this is hospital, you have to obey us. So like that, it will make him understand that the barrier will be not there. So this is what patient related barrier. This is patient related barrier. And now we will see last, that is environmental barrier. This is the seventh one. This is the seventh barrier. Physical setting, time constraint, technology and organization. This technology we studied in physical barrier. Again we will study here. Physical setting means just that also we study there. Noise, lack of privacy, uncomfortable room layout and extreme weather. Means these all things, means noise, yes, already we studied there first itself. Second is what? Lack of privacy. If noise is there, we can't communicate with the patient. Lack of privacy, if patient is not feeling comfortable, if when you went to talk with patient, the patient is looking here and there, means by seeing his posture itself, how he is behaving, that time you have to understand he is not feeling that much comfortable, he is feeling shy or something like that. You can ask her that yes, can I close the room, close the window, or can I put the curtain? So like that you have to ask the patient, so then the patient can talk to you easily. And uncomfortable room layout is, this is also what room, if a room is not in that position, that patient is here and in front of another patient is there, and the patient is not feeling comfortable by seeing another patient, so this is also be a barrier. So that also you have to make comfortable to the patient, then the barrier will be overcome. Then extreme weather, sometimes what happen, too much of hot or too much cold, patient from himself only, he was not comfortable to talk to you. So on that time, at that particular time, you are going to the patient and trying to talk with him, means the communication will be not proper. So that's why what happened, we have to always keep in mind that how is patient, what he is comfortable, he is calm, quiet or not. By seeing that only we should communicate with the patient. So if we'll do all these things, means physical barriers never come, means the environmental and systemic barrier, this is what noise, lack of privacy, this is what environmental barrier, that should not be there. Then the time constraint, means particular time periods, particular time period has given to complete the task, means you have to complete the task within this much time. So if the task is too much, means it being very lengthy or very difficult, so it won't be comfortable to the person whom you have given task. So in this case what happens, this is a barrier. So for that, what is the overcome, the person may talk to you, ask you that ma'am, this is too long and I have no time to make this one that soon, so please give me some more time. So that will be overcome from the time constraint. Then technology, yes, technological glitches or lack of access, yeah, means for some time, yes, before itself I told you about that technology, how technology accessibility, when we studied there, I told you that technology, how it affect to your communications, means like I am talking to you now, right now I am teaching to you and my voice is not audible to you, that much I am giving my pressure, my mind I am using there, but everything has been useless. Means why? Because of the mic. If the mic is not in the technically, if the mic fault, then it will be not effective communication. So first I have to check my mic and that either it is working or not, then I should teach the student. So this is what, this is the technological barrier. Then organizations, yes, in organizing inadequate training, policies or resources for effective communications. Organization means you want to organize something for the patient in hospital, and if you don't have knowledge, inadequate training, you can't train the patient, or you are a head of the psychiatric nurse and you want to you want to make one, or you are organizing one training for the other nurses, but you only don't have the knowledge regarding what you are going to speak, what you are going to talk to your colleagues, then what happen? That communications will be not effective. And without asking someone, if you are in a hospital, there is a policy, you have to obey the policy. Directly you just you thought and directly you inform everyone, please tomorrow you have to come in this time. So they came, they gathered, and you did everything without asking to your senior, without asking to the director. So you have to obey the policy also, rules, regulations. That is what, that is the policy, means policy error may occur. So this is what organization's error means. What we are organizing, before that we should be keep in mind that everything, the training the training knowledge, the permission has been granted. So everything you have to keep in mind, then only the barrier will be not occur. This is the overcome from the organizational barrier. So this is last, seventh one. There are 7 type of barrier: environmental and systemic barrier. So this is the last one. So very shortly we will see. First one is the language and semantic barrier. There we saw the jargon, language differences, post listening skill, Then cultural and social barrier, again that has been there in patient barrier, from patient barrier. So third is what? Psychological emotional barrier. This is also two times has been given. And fourth is what? Physical barrier. And sixth is patient related barrier. Fifth is healthcare provider barrier, from our side whatever barriers may arise. And sixth is the patient related barrier, from patient side which barrier can affect for communication. And seventh one is what? Environmental and systemic barriers. So this is four types: physical setting, time constraint, technology, organization. So this is what? All about the barriers of communication. So today we studied about the barriers of communications. So today barriers of communication we studied. In Hindi also the topic already I have made. So if there any doubt, any question, comment me in comment section. I'll try myself best to do anything is possible. So if there is any type of feelings, any type of goodness you are feeling here, if it is beneficial for you, please do like and subscribe to my channel, and don't forget to click the bell icon. Thank you.